You are watching or listening to Purham and Associates. For more information, go to rpurham.com or follow me on all social media platforms and subscribe at RPURHAM. Thanks. See you over there. Hey, good day to you all. Welcome to Permanent Associates. I'm your host, Randy Purham. And I hope you all have had a fantastic week thus far. And looking forward to, the weekend. And of course, this is, it is Friday. This is the time we take to thank our men and women who have served our nation around the world, sacrificing and committing their time, their freedom, and protecting our freedom, our Constitution, and our way of life. And we thank you and we salute you and wish you a safe journey back home to your friends, family, and loved ones, wherever that may be. And with that being all said, we got a very special guest with us today. Of course, most of y'all probably already know who he is by now. But if you don't, we have none other than Dr. Salvatore Giorgianni. He is a senior advisor for Men's Health Network, spanning a 40-plus year career as a practicing clinical pharmacist. He is an advocate for better health services and resources to enhance the health of boys and men. He has held faculty appointments at both Columbia University and Belmont University and has authored over 70 peer-reviewed and general media articles in healthcare and health policy. Men's Health Network is a national nonprofit organization whose mission is to reach men, boys, and their families where they live, work, play, and pray with health awareness and disease prevention messages and tools, screening programs, educational materials, advocacy opportunities, and patient navigation. Ladies and gentlemen, introducing the summer presenting the others, Dr. Salvatore Giorgianni. Good morning, sir. Welcome back.
Thank you for having me back on. Boy, I like that photo. I had a little color in my mustache and hair there. I'm gonna have to go dig that one back up and see if I can find that again.
Yeah, you're aging gracefully, Doc, and myself, I'm graying out, and I'm just like, every time I go to the grocery store now, if I'm going down like where the hair coloring products and all that stuff is, the hygiene stuff, I pick up a box and always says, put it down, just let it go, just let it go. And I'm like, no, I want to look young again. She's like, you look fine, just shut up, just deal with it.
Well, thank you. I just turned 75, and I'm happy to be able to say I'm 75. Not everybody can do that.
You're absolutely right, and amen, and congratulations. And you got another 75 years in you, so you got it.
I'm hoping for it.
Yeah, in this day and age, it is possible. So, I continue. I wish you a continued long health and good health and success. And
Thank
so,
you.
absolutely. So, tell us, Doc, what have y'all been up to the last couple of months?
Well, it's been very busy. We're looking at all sorts of health issues for boys and men. Men's Health Network at www.men'shealthnetwork.org has an awful lot of information. We're coming up to Prostate Cancer Awareness Month. We're looking at vaccinations. I know that's a controversial topic, although it shouldn't really be. And we're looking at the importance of vaccines for men and their families. We're helping men make a decision, which I think is an important part of autonomy. As an American, you're able to make a decision. And if you want to get vaccinated, we're looking at prostate health and all of the other circumstances that unfortunately have led to such poor health for boys and men. But I'll tell you, recently, because of the tragedies we're seeing play out on the media day in and day out, there's been a lot of discussion about media violence. Are we becoming desensitized to violence? The role of social or anti-social media in desensitizing our children and adults and older adults as well, of my vintage, to violence. And we're really concerned that the society we're living in now is missing one key element to managing healthy attitudes about what we're viewing online and what we're reading about, and that is parental awareness. Men's Health Network, as with many organizations, have a view that parental guidance, particularly for boys, with their dads and other men in their lives, need to be good role models, be aware of what their children are engaged in, and then moderated.
Yeah.
I was talking with someone just the other day who said that his 14-year-old daughter wanted to watch the unfortunate, terrible assassination of Charlie Kirk and watch the video, and I said, look, that's a great sign when you have the kind of rapport that it takes with your child to come over to you as a guiding influence, a positive guiding influence in their life, to say, I want to watch this. I think that's a very positive sign. So the wind-up, they watched together, they talked about it. And that I think is something that's terribly important, as we're not going to watch this violence go away.
Right.
It's not the story of mankind. We're not going to watch the media go away. We're going to watch the media continue to evolve to an on-demand sort of scenario. And the one thing that's in our control is how we interact with the people we love, whether it be our children or our spouses or our older adult colleagues that we know from work or the community center.
Yeah, you're absolutely right, Doc. And I want to back up real quick. When you said parental guidance, it seems to me, and I'm sure you'll agree here, that the parents of today, they too need guidance, because a lot of them are encouraging and teaching their kids. A lot of them are encouraging and teaching their kids to be, extreme in a sense, or they're not paying attention to what they're watching and interacting on social media with and what have you. So I think personally that we need to take it back, or maybe even implement a thing called grandparental guidance, where the older generation is like, hey, you need to be paying attention to your kid, or my grandchild, and make sure they're not doing these things, because the parents, they're kind of like just oblivious to what's going on these days. And we're seeing more and more. I was just watching a clip just yesterday where this mother, she came home and her two daughters, she was recording them, and her two daughters, she said, guess what? I got great news. And the one kid responded and said, Trump died. And she was like, no, that would be great, but that's not, so it was this dialogue going back and forth where she's encouraging the kids to glorify somebody being killed. And it's just like, wow, is this where we at in society? And then, you rewind it back, just last week, or the week before, where you had a transgender person, shoot up another school, and what have you. And so we're seeing this string of transgenderism going on the haywire, if you will. And I want to ask you about that, because, like you said, the desensitization and the normalization of violence that's in the political discourse, it seemed like it's festering from just not only a mental health perspective, but from just the environment in which we're, eating certain foods, taking certain pills or medications. You're seeing now, these commercials with disclaimers saying, this medication may cause suicidal ideations. You notice they never say homicidal ideations. So a person that's taking this medication may say, you know what, I'm feeling violent because of this medication. I'm not going to kill myself. I'm going to go out and kill somebody else. And then so I just want to get your thoughts on that.
Well, there's an awful lot in there, but let's start with the situation, which I think is very real, that parents may need help in raising their kids from grandparents, from uncles. In the society gone past, well, really in society always up until about the 1960s or so, when we became a modern society where both parents were working, and a much more mobile society where parents and grandparents were often in the same community, sometimes the same house, but often in the same community. It was an interconnectedness there. The grandparents were still being a parent when they're older. We're blessed with 5 wonderful adult children, and I constantly remind myself that I'm still their parent. So I am learning how to be a good grandparent and parent of an adult with professions and children. And I don't often interject my opinions, but I will offer some observations when I feel that it's very important to.
Right.
My
Yeah.
kids accept it. They don't love it, but they accept it. So I think that's
Yes.
one thing. The other aspect is that the change in the structure of the American home, where both parents were there, where they understood not only their child, and this is important not just for kids but for other adults, as we saw with the scenario with the person who assassinated Charlie Kirk. As they become adults, as they become seniors, you have to continually observe what they do. Look for subtle and sometimes not so subtle clues that show a change in their thinking, their behavior, because we're constantly exposed to toxic things in radio and media, and they're not going to go away. So one of the things we did when we were raising our 5 was we became very friendly with their friends. We had a house full of kids all the time. We spent a lot of money on dinners and food and parties because we wanted to see who our kids were hanging out with. And one of the things we observed, which saved us from a family tragedy with one of our children, when that kid was growing up and around 12, 14 years of age, is that their friends came over and said, gee, she's not behaving the way she used to. We haven't seen her as often as we had. She's not doing the kinds of things that we used to do together. There's something going on with so-and-so. And we heard that loud and clear, and we took action, which I think was very important action. So that's not just parents need to understand that. Grandparents probably too are part of that community, and I think need to get back to understanding how to be good parents to their kids. It's a lifetime sentence being a parent, these days. So I had the privilege to have that sentence. So again, I go back to family as an important part of this solution to this terrible problem.
You're absolutely right, Doc. And you brought up a very good point about the communal aspect of raising a family and being not only as a parent. I think there's a conflation here that adults think that they should not be be friends with children in a sense. And just like to your point, you said you're very friendly with your kids' friends when they come over and everything else, and making sure that they have something to eat, and being looked after. The parents these days, they think that means that you're trying to be their friend type of thing in a more intimate sense. And it's like, no, you're just letting the child know that they're safe in your environment, and that you're willing to take care of them just like you would take care of your own child type of thing. And so there's that confusion there. And so I commend you for bringing that up, and thank you for bringing that up, because we have gotten away from that. I'm guilty of it myself. When my children are now adults, when they were younger, when they brought friends over, I removed myself from the room because I was like, I don't want to hear your conversations. I don't care what y'all talking about. There's pizza in the fridge. Don't burn the house down. And I left it. Let it be. But I did pay attention to like their interactions in terms of like what they were doing. but conversations and stuff like that, they were largely innocent, everyday teenager conversations. So didn't have a problem with that. But we have gotten away from that. And I wanted to, and you brought up another good point about how the radicalization of a child once they become an adult, and as their parents are getting older and moving on with their lives, they're like, finally, we're empty nesters. I was just talking with a friend about that. She says she's happy that she's an empty nester, kids off to college and everything else, so she's going to go travel and do other things. So we lose sight of how our children are evolving as adults. And this is the situation with Kirk's assassination of this person. He grew up in a conservative household, left, and became extremely radicalized, like essentially, over a short period of time. And the parents were like, okay, yeah, we see this, but what do we do about it? They're grown, and so it's kind of hard to manage that as parents, no matter what age you are, when you see your children developing a sense of behaviors and whatnot that you may not approve of, but at the end of the day, they're adults. So what do we do about that?
Well, that's a terrible dilemma. I will say that one of the things I found intriguing is that the fellow who assassinated Kirk went back to his parents. He was concerned about how his parents would view him. There was still a fundamental shred of humanity left in him. And he was, I think, amazingly brought in by his father to the scenario. So, there's always going to be a small segment of population who, no matter how caring the environment is, no matter how astute, no matter how adroit, no matter how careful or skillful you involve yourselves in the matters of another individual, there are still going to be criminal acts. And I think that that's something we just have to recognize and deal with. But I think we need to minimize that. And one of the ways to minimize that is observing and being part of someone's life. Men express their emotional wellness, their emotional hurt, very differently than girls do and women do. And we have to be sensitive to the fact that one of the ways that men show emotional pain, emotional distress, is withdrawal, change in the environment, movement towards anger and hostility. And that's very different than the way girls do. So the reality is, unfortunately, there's still going to be some small segment of society who engages in terrible, terrible acts. But the fault of social media, I think, here, in giving them 24/7 access and play, I think leads to another reality of moving forward, which is, if you want to watch these terrible things and cause that excitement phase, you have access to it. And that, I think, unfortunately, is something we can fortunately, that is something we can control.
Yeah, I agree with you there. And I want to get your thoughts on whether or not video gaming, violent video games, that is, and movies, violent movies, are these things contributing to the violent culture that we have today, or are these things, or would you say they're mutually exclusive? You can watch a violent movie, play violent video games all day long, but you can go out and be the most peacefulest person in the world. I see. I'm one of those guys. but do you think that that's a factor there?
Oh, absolutely. Look, when we were kids, we watched Tom and Jerry cartoons all the time.
I still do.
Listening may remember Tom and Jerry.
I still watch it.
They weren't exactly a fairy tale. Yeah. We would watch Superman. I don't think many children were jumping out of windows wearing a make-believe towel cape, although it happened.
Yeah.
In researching this topic for discussion, I went back all the way and looked at Roman days, the Colosseum, the gladiators. It was a constant barrage of violence, but there was a ability to moderate that on the part of individuals, that it's what they watched and it was part of society then. But now we're losing something which is the humanity of individuals. One of the dangers of video gaming, to the point of where it's extended, we saw manifest in the stabbing death of the young woman, the Ukrainian woman, on mass transit, where people were completely oblivious to what was going on. In fact, they turned their heads away as if it was a show they didn't want to watch on television. That's a very bad sociocultural sign. It's something we lived through in the 60s and 70s, where I grew up in New York City. Crime was happening on the street. People didn't want to get involved. And I think in large part, the media and some of the misguided judicial processes, where we had that young Marine watch a very similar scenario of someone who was menacing in a New York subway, who intervened, stopped, and then was prosecuted. Some would say persecuted.
Yeah.
We have to, as a society, do a much better job in providing safe harbors for individuals who are willing to step in and avert a disaster, as well as provide guidance to folks who feel that these individuals are not human. And that's part of the problem with Charlie Kirk. He was a caricature, not a human in the eyes of the perpetrator.
Yeah, you're absolutely right. And I thank you for that, because the idea that people are just standing around, they pick up their phone, or they're buried into their phone. They don't even look up and, pay attention to their environment, let alone, looking after somebody else that could potentially be in trouble, or themselves for that matter. And it is a sad state of affairs that we're in when we have this kind of environment. And you see these bulletins that say, you see something, say something. Well, hell, you can't see anything or say anything because you're buried in your phone, or you're willing to turn a blind eye and not say anything because you're afraid of, I might get in trouble, or I might end up getting hurt in the process of trying to save this total stranger that I don't know. And so we have cultivated this society where we lost focus of humanity. We lost focus of taking care of one another and being able to say, what, that's not right, that's not cool, don't do that, and type of thing. And so I appreciate that. And before I let you go, Doc, I want you to share any final thoughts you may have and where people can follow you and support you, sir.
Well, two thoughts. One is, if you are troubled or you're engaged in seeking behavior, seeking activities that overexpose you to graphic violence, it's not an excuse to say, well, I can't avoid it. You can change the channel. You don't have to watch it. You can change the channel to something different. There are lots of ways to get enjoyment, entertainment, and diversion of thinking. So don't subject yourself to something that could cause, I guess, an addiction to violence or dehumanization of other individuals. And if you want to find more information about overall health, including mental health issues for boys and men, please go to www.menshealthnetwork.org. There's a lot of information about medical conditions, everything ranging from blood pressure control to cancer management and proper biomarkers for identifying cancer to mental health issues and healthy parenting. So we encourage folks to go to www.menshealthnetwork.org.
Sweet. Thank you, Doctor. I appreciate you, and thank you for coming back and sharing this wealth of knowledge and information. It's very important in this vital time that we're in right now, and I hope people take heed to your wisdom and your advice. And look forward to having you back on again soon.
Anytime I can be a help to you and your audience, please invite me back.
Will do.
It's a pleasure as always.
Absolutely. Thank you, sir. Be safe and God bless. And take care.
Same to you. Bye.
Ladies and gentlemen, that's Dr. Salvatore Giorgianni, menshealthnetwork.org. Go there, get the resources. If nothing else, if it's not for you, you know somebody else that may need it. I certainly do. Oh my God, I do. And so, it's very important to have these discussions and point out, not necessarily call out and try to publicly embarrass somebody, but just you call it out. You pull that person to the side and say, "Hey, I'm concerned about your mental health. I'm concerned about your attitude. I'm concerned about whatever that the problem may be." Address it, and help them get help or help them remedy the problem. Because sometimes it can be something as simple as, "Man, I was just having a bad week and I need a drink," or "I'm having a bad week or bad day and I just need a nap," type of thing. And it's like, okay, all right, I understand. Let's get you accommodated so you can calm down and not do anything crazy, type of thing. Or in the reverse, if the person is having, all of a sudden they're just chipper and happy, and them to be like this evil person all the time, you might want to check on that too, because they probably did something, or they probably on some kind of drugs or meds or something. You never know. And so it's a lot of that going on these days. And I encourage you all to really step up to the plate as a member of this society and pay attention. It's cool to be in your phone if you're sitting down in a park bench somewhere. Okay, but every now and then look up and look around, make sure that the environment that you're in is okay. I can't stand the fact that when I'm driving down the street and it's just all these pedestrians walking around, and they're not paying attention to anything. A couple people almost got hit by a car yesterday. They stepped out into the street. They not even looking at you may have the little walking, it's okay to walk across the street sign, but you still not pay attention that person may decide they're going to run a red light, and they almost got hit. It was two of them, and so I was just like, wow, and it's just crazy stuff. But folks, it's Friday, I like to jump up out of here early, so and I got some stuff to do. So be safe out there, and I will see you all next week sometime. Not sure when, but yeah, thank you all for tuning in today. Truly appreciate you. And if you, I must do this as well. Don't forget to donate to support my book project. GiveSendGo.com/book project 2025. Raising money to get my book published. It's a thriller, if you will. It addresses a lot of these things that we're going through in society from a historical context, a recent contemporary historical context, just stemming back to the 2016-15 time frame, all the way to now. So, just an overview of what we've been through and where we're heading and how we can fix it, how we can stop it. So check that out. And folks, like I said, I'm gonna jump up out of here. So I'll catch you all on next week sometime. Take care. God bless. Be safe. And ciao, ciao. I hope you enjoyed today's program. You can follow, like, share, subscribe on Spotify, Substack, Rumble, YouTube, Facebook, and your news. And also, you can download Let the Truth Be Told app on your favorite streaming platforms, such as Fire Stick, Apple TV, and Roku. Take care. God bless.